It's a very small and select gathering, and I hope I will be reasonably brief. I don't want to bore you with a long description of everything that the Australian government is doing, and there are some much more interesting presentations to come after mine. But I just wanted to share a few things about what we have been learning through the partnership between Australia and Indonesia in the health sector, where the partnership is going, some of the lessons that we have learned from it so far. So could I get the next slide, please? Health around HIV/AIDS, some support following disasters like after the tsunami and so on, and then after the outbreak of avian influenza, we got more involved in supporting emerging infectious diseases. Currently there are 4 main programs. I won't go into a lot of the details. Lots of acronyms there. The AIP is always the Australia-Indonesia partnership. And then we have, the first one is HIV, which is still our largest program financially speaking. We have maternal and neonatal health. We have health system strengthening, and we have emerging infectious diseases. So those are currently the programs that we're running here in Indonesia. A few other small initiatives, but these are the main ones. Some notable through the partnership. So under the AIP-MNH program, we're still in the process of examining the evidence and documenting the results. But we're pretty clear now that there is really strong conclusive evidence that there's been a 40% reduction in maternal mortality in NTT over the last 5 years, which is impressive by any standard globally. There's been a reduction in HIV transmission amongst people who inject drugs, so that now injecting drug use is no longer a major driver of the epidemic in Indonesia, although we can't claim all the credit for that. There are some changes in injecting practices and drug use practices and so on. Rapid scale-up of HIV and AIDS testing and treatment in Papua, so that the coverage of treatment of antiretrovirals amongst the eligible population is now higher in Papua than it is in the rest of the country, which is quite an achievement considering the challenges of operating in Papua. Rolling out these acronyms, the AWARS is the Early Warning and Alert Response, is it? Early Warning and Response System, which is a surveillance system for outbreak-prone diseases. And we have the ISICNAS, which is a similar program for animal health. And I was just discussing with Professor Ascobat about the importance of addressing animal health if we are going to be addressing human health, to go more upstream to stop outbreaks in animals before they get into humans. And so the ISICNAS is an information system that actually tracks outbreaks of disease amongst animals in real time using mobile phone technology, and it's actually quite impressive. Okay, next slide. The combination of political ownership, technical support, and institution building is really crucial. You can't just do the technical support. I think sometimes projects are designed to bring in a technical fix, but actually, if you want a sustainable solution, you've also got to be building institutions. You've also got to be addressing the politics and making sure that there's political buy-in. These 3 are really inseparable, and if we want to see success in development, we have to see these 3 going together. We've learned that, coming in as a donor with donor-funded projects, we don't want to be setting up parallel systems. We want to be aligning with government processes and cycles, and wherever possible, working through GOI systems. It's not possible. We want to work through the government system, and certainly aligning with the government cycle, so that whatever we do is within the government's own planning. And certainly the NTT government has frequently mentioned that they appreciate that all of our plans are aligned with their plans. Sometimes I think donors come along and want to run a project and see some quick wins, and you're in there, and by 3 years you've seen some results and you're out again. It doesn't really work like that. When you're looking for systemic change and sometimes cultural change, you've got to be in there for the long haul, and I certainly hope that on behalf of the Australian government, I can say that we are in there for the long haul. We are neighbours, and Australia and Indonesia are going to continue to work together on health systems for many, many years to come. Although, as we will see, the kind of relationship is changing. We've learned that the continuum of care approach is really essential, and there's two dimensions of that. There's the levels of the health system, so we're looking at sort of demand at the community level, and then thinking particularly about addressing things like maternal mortality, child mortality. We've learned that just coming in and trying to fix one part of the problem just doesn't really do it. You've got to address the whole spectrum of issues. So starting at the community level, looking at the links to the primary care system, looking then at the referral chain from the primary care to the secondary care and how it all fits together, demand side and supply side, that's really important. The other aspect of the continuum of care approach, of course, is the life cycle approach. I'm very happy to see that the government of Indonesia is now moving much more towards a life cycle approach. So not just intervening, say, around what happens at delivery, but what's happening to the woman before she ever gets pregnant, how healthy is she, how well nourished is she, what happens during the pregnancy, what happens afterwards, who's following up the child and the mother after that, and then going through some of the neglected periods of the life cycle, like adolescent health, which is I think has been a priority of the previous health minister and of the current health minister, which is very good to see. That we are still grappling with, but we've learned is really important, is what's the plan for sustainability, replication, and scale-up? We talk to people in the Ministry of Health. My good friend Ibu Kita Maya constantly comes and says, donors keep doing these sort of projects here and there, and they're quite successful, but then they never get replicated. So what's the use? So we need to be looking from the very beginning. How is something going to be replicated? How is it going to be scaled up? What's the strategy for that? We have some good examples. I think now, part of our HIV program is working in prisons, and we have agreed with the Ministry of Justice and Human Rights that we will pilot the approach in 11 prisons, but they will allocate their own resources to scale that up across the rest of the country in their own prisons, and they are doing that. We are focusing on setting up models of excellence in 11 different prisons, and there's a clear strategy in place for scale-up. This stuff we've seen also very successful. I mentioned the AWARs. We've piloted it in some provinces. USAID also piloted it in some provinces, and now the government is basically rolling it out using domestic resources. But reduced maternal mortality in entity, but how does that get scaled up across the country? A lot of provinces have seen an increase in maternal mortality over the same period. I'm not sure that we have a clear strategy yet, although we're working on that. People who inject drugs and the HIV issue, yes, we've seen a reduction, but in some parts of the country not so. We saw from the last IBBS that in Pontianak, it's just skyrocketing through the roof. So what's the strategy there for replication? Not yet quite clear. And one of the big factors there is NGO funding. In the fight against HIV, NGOs play a very crucial role, but the government is not able to fund NGOs in a sustainable way because of the law. So how do we deal with that? And we haven't yet really found a solution to that. And sectors and working across government. So we're not just talking about health in a silo. I think that's also very important. Yeah, next slide, please. In transition, moving from being a donor to a partner, moving from gap filling, which was how some of our programs were set up, very focused on MDGs, moving towards systems building, and moving from the MDGs to what now certainly the Australian government strategy is all about, is sustainable, equitable economic growth. And human capital is seen as a necessary prerequisite to sustainable economic growth. From a siloed approach to an integrated approach that's within the health sector, moving from vertical to systemic, but also from health as a sector to health as an outcome. Health outcomes to be achieved by multiple sectors working together synergistically, different kind of approach. Also recognizing new challenges, nutrition, particularly the double burden of nutrition that we're now seeing with persistently high rates of undernutrition, stunting, but also rapidly growing levels of overweight and obesity. NCD is very related to that vast, rapidly growing epidemic of NCDs. And at the same time, the phase out of some of the major donors. Gavi is already basically out. The Global Fund is not going to be here for much longer. And as was mentioned yesterday, you know, some of those items on Professor Escobar's line items as to where the money is, you know, if you take away the Global Fund, some of that is just not funded. So, you know, what is happening, because the Global Fund is on its way out over the next few years. So, you know, it's a challenge there. And from the Australian perspective, we're going to have to operate. The reality is with a slimmed down budget. The Australian government is reducing the budget. Next, to read or see any of all the details of this, I hope that you could get a copy of the presentation afterwards somehow. But this is actually taken from our theory of change for our strategy for engagement in the health sector in Indonesia. And what I want to draw out is that there are 3 causal pathways which lead to the higher level outcomes. So that the sort of medium-term health outcomes, the pink row there, is things like reduced total fertility, reduced child mortality, reduced maternal mortality, and so on, reduced stunting, all of that, reduced incidence of diseases, which all feeds further up into the sort of economic growth development agenda. But there are 3 causal pathways there which all have to be addressed. The one on the left is basically the health system. All the stuff that happens within the health system. So we're talking about human resources, talking about leadership, you know, the familiar building blocks of the health system. The one in the middle is the demand side stuff. The health-seeking behaviors, healthy communities, healthy families, and so on, and stuff that people have to do really at the individual and the community level. And then the stuff on the right is the enabling environment, which is about, you know, other sectors, the built environment, whether you've got water and sanitation, whether there's a social protection system in place, a lot of other things which are addressed by different parts of the government, not by the health sector directly. And I think we need to look at achieving health outcomes through all, you know, looking at these 3 causal pathways together, working synergistically. Yeah. Of course, a much bigger population, but and the total size of the economy, I think now Indonesia is already bigger than Australia. Australian support compared to the size of the Indonesian economy was always small, but it's getting smaller. It's not about the money. You know, the money is not really going to achieve anything. It's about what Australia has to offer in terms of ideas, innovation, and including having one of the world's best health systems, which has a lot to offer and from which Indonesia can learn a lot. There's specific expertise in some of these areas. These are just some examples where we are already providing expertise. Obviously, HIV and AIDS. Australia is a global leader in HIV and AIDS control work. The pharmaceutical benefits scheme, the health technology assessment, the whole, very relevant to this conference, case mix payment system, DRGs and so on, really, really important areas of health financing and how the nuts and bolts of the health financing fit together. Also a very good experience working amongst hard-to-reach indigenous populations. Australia has hard-to-reach indigenous populations and has some pretty good approaches to how to reach them with health services. Facilitate wider international engagement. Obviously, a lot of what we provide is from Australia, but it doesn't have to, it's not exclusive. We don't have a tied aid program that has to bring in only Australian expertise. And we do bring in, you know, experts from all over the world. I myself am not Australian. Jack here is working for us, he's not Australian. You know, so I mean, there's expertise that we're bringing in, for instance, from Canada now on human resources for health. And also we can facilitate South-South cooperation, which is not always easy for Indonesia to organize by itself, but we can play that broker role also. Yeah. So our approach going forward is basically a twin track approach. I'll just go through this very quickly, only one more slide after this, I think. So working at 2 levels. At the level of sort of policy and strategy development at the national level, but you know that can't work in a vacuum. So at the same time supporting demonstration models of effective service delivery at the local level. And our emphasis is always going to continue to be on the poorer Eastern Indonesian provinces, testing things on the ground and trying to make that link. As it says at the bottom, the two need to work hand in hand, which doesn't always happen in Indonesia. And Indonesia is not alone in this respect, but Indonesia is a very highly decentralized country, so this is quite a big issue here. How do you join up the national with the local? And we want to be able to help to facilitate that. So demonstrate, how things can be done better on the ground. So, for instance, in NTT, how do you, show in practice how do you actually reduce the number of women dying in childbirth, or in Papua, how do you actually scale up treatment for HIV? But then how does that feed into national policy, and vice versa? How does the national policy translate into practice on the ground? If there are new things that you want to develop at the national level, how can you test them? We can help to test those approaches on the ground. Next, please. In summary, I think what Australia has to offer is both building people and building institutions. Building individual capacity, we have big awards programs, scholarships, we provide training, we can provide mentoring and coaching by international experts. A lot of that is targeted at individuals and quite large numbers of individuals that hopefully form a critical mass. But going beyond that to build the institutional capacity, developing institutional partnerships. We want to do more and more of this between Australian, other international institutions, and Indonesian institutions, continuously providing international technical assistance to build that capacity here on the ground in Indonesia, again focusing on strengthening the systems, not the vertical approaches, but the systems approaches, and as I said, and I would say again, a long-term engagement. So we hope that we can be an external catalyst that helps to challenge the status quo in a friendly way. There's some challenges can be a bit unfriendly, but we always hope to be a friend and a partner with Indonesia to challenge the status quo, demonstrate how things might be done differently, fostering innovation, and in that way continue what I hope will be for many years a continuingly friendly and fruitful partnership.